I'm Tara Raphael, Ayurvedic practitioner and midwife at Wise Womanhood Holistic Women's Health. Welcome to Understanding Female Cycles. This video will teach you about the many cycles the female body goes through each month during the fertile years. Also watch my YouTube video, Female Anatomy, for more information. The basic cycle most women know is this. You have your period for a few days, then there's little or no discharge, followed by some increasing discharge around the middle of your cycle for several days, then relatively little discharge again until menses comes around. Remember, taking the pill or other hormonal birth control alters this and most other female cycles that we'll be learning about today. Normal cycle length can vary at different times of life for different women. The difference in cycle length for any woman is commonly due to differences in the time it takes to ovulate. The time after ovulation stays fairly standard for any one woman. This equals the amount of time her body waits to see if a pregnancy happened during that cycle and is supported by the hormone progesterone. There are many interacting female cycles we'll touch on today: hormonal cycles, endometrial cycles, ovarian, cervical, and uterine position movement cycles. Notice this graph, the various lengths of estrogen and progesterone and how they relate to the bottom line, showing the healthy vaginal discharge you can see in response. The pink line marks ovulation. Estrogen is produced by the pre-eggs that develop in the ovaries. Estrogen has lots of functions in the body, and I'll just highlight a few. By the way, even though women have more estrogen, men also have it in their bodies. Our estrogen creates a female look to our bodies beginning at puberty. It stimulates the lining of the uterus to rebuild after menses, among other important functions. These are the non-reproductive functions of estrogen. They come in handy, and many are emphasized during pregnancy. Another important function of estrogen is promoting and maintaining the uterine lining after ovulation to prepare it for implantation of a fertilized egg. It's crucial during pregnancy, and during labor and orgasm, it promotes reception of the hormone oxytocin in the uterine muscles, helping with the contractions of both labor and orgasm. Estrogen, along with other hormones, also give women sexual desire, which most of us find to be a very good thing indeed. Progesterone is released by the corpus luteum, or the egg follicle, after the egg is released at ovulation. It is all about getting and staying pregnant in its functions. Progesterone may help sperm swim better, may be a homing signal for sperm to find the egg, prepares the endometrium for implantation of a fertilized egg, stops the fertile mucus so no extra sperm get in, decreases maternal immune response to allow for accepting of pregnancy, and decreases uterine contractions, calming the uterus. Progesterone inhibits milk production during pregnancy and may help start labor. It helps the fetus make its adrenal hormones so it can deal with stress. It helps the nerves throughout the body as well. The many other functions of progesterone are too numerous to mention, but include increasing our core temperature, which is how we can tell we've ovulated using a basal body thermometer. Our progesterone is up, and so is our temperature after ovulation. There is a complex interplay of several hormones that creates the cycle through stimulating or inhibiting each other. Let me know if you want a PDF of this for further studies. Gonadotropin-releasing hormone stimulates the pituitary to produce follicle-stimulating hormone. During the early pre-ovulatory phase, the pituitary secretes low levels of this FSH. FSH stimulates growth and maturation of follicles or pre-eggs. As follicles grow and mature, they secrete estrogen in increasing amounts. Rising levels of estrogen tell the pituitary to gradually lower FSH levels, and then estrogen, when at high enough levels, tells the hypothalamus to secrete a surge of luteinizing hormone. The effect of the luteinizing hormone surge causes the most mature follicle to rupture in ovulation, releasing the egg, and the rest of the follicle stays to form the corpus luteum, or white body that secretes progesterone. After ovulation, LH stimulates the corpus luteum to secrete this progesterone and estrogen to prepare the uterus for implantation. Rising levels of estrogen and progesterone tell the hypothalamus pituitary to reduce the LH. As LH decreases, the corpus luteum starts to degenerate. Unless an embryo has implanted within about 10 to 12 days of ovulation, the corpus luteum stops producing estrogen and progesterone. The endometrium is no longer maintained and begins to deteriorate and shed with the help of prostaglandins, resulting in menstruation. During menses, estrogen, progesterone, LH, and FSH are all at their lowest levels. Low estrogen and progesterone levels then stimulate the hypothalamus to start the cycle over again. The ovaries cycle monthly. In fact, it's their cycle that creates the crucial outer signals of cycling that you notice, your menses and your fertile fluids. Starting on the lower left side of the picture with the primary oocytes, these are stimulated by the follicle-stimulating hormone to begin developing. These developing follicles produce estrogen. One of them then becomes mature and is stimulated by the LH, released when estrogen reaches a high level. Then the egg emerges to travel through the egg tube or fallopian tube. Meanwhile, the follicle left behind morphs into the corpus luteum, which produces progesterone. This, along with estrogen still there, maintain and transform the uterine lining so that it can best receive a fertilized egg, if one appears. Then there is none, then the corpus luteum degenerates, quits making progesterone, and then you get a period within a couple days. And here are some actual photos of ovulation. Whitish background is the ovary, the reddish bulb is the follicle, and the yellowish blob is the egg. The very beginning of the follicle development actually begins about 150 days before ovulation. The egg is slowly developing, and during the period of 90 to 120 days pre-ovulation, the egg quality can be greatly influenced for better or worse. This is where our natural remedies and good nutrition can often make a very big difference. The endometrial cycle can now make sense. Estrogen and progesterone interplay to build and prepare the lining of the uterus. After menses, estrogen is being created by the follicles, which begins the rebuilding of the lining. Then when ovulation comes, progesterone increases the blood supply, and various prostaglandins and estrogens help prepare the lining for implantation of a fertilized egg. If no fertilization happens, then the corpus luteum dies off, and a couple days later, the next period happens. Did you realize that, in a way, we go through a mini menopause each cycle when our hormones drop just before and at the beginning of the menses? In the cervical cycle, the cervix, doorway into and out of the uterus in the vagina, also responds to our female hormone levels. As you'll see in the following photos, the mouth or os of the cervix opens during menses and also during ovulation. Even more importantly, in the tiny channel leading from the outer to the inner part of the uterus, there are little branches called cervical crypts. In these crypts, cervical mucus is created. There are two types. E-type is present more at the time of ovulation when estrogen is high. Represented in the right circle, it actually feeds sperm and gives them strands that help them swim up into the uterus. You may have noticed this egg white-like type consistency mid-cycle. The G-type mucus, shown in the left circle, is inhospitable to sperm, killing them within minutes, and is stimulated by progesterone present to prevent excess sperm coming in. Let's see an example of how a cervix changes throughout the cycle with some real photographs donated by a 29-year-old woman. Here we see her cervix 4 of the days of her cycle. On the top left is when she is menstruated. You can see that the os is open. On the top right picture, it's day 6, I believe, and you can see that the mouth is much more closed. Day 12 in the bottom left is where she thinks she's ovulating. The os is open and there's clear, stretchy mucus coming out. On day 22, the os is closed. The hormones not only affect the os, but they also loosen and tighten the ligaments, and that will bring the cervix into different positions. When the estrogen is low at menses, the uterus os is tipped backwards. As estrogen levels rise up before ovulation, the cervix starts to open, soften, and straighten upward. Around ovulation, at the height of estrogen, the os is very open, very soft, and the uterus is standing up from the vagina, creating a straight highway up towards the egg for the sperm to go. By checking for cervical position regularly, you can learn this other sign. This final chart shows how some of the various cycles line up over time. Ovarian, endometrial, hormonal, cervical mucus, and temperature shifts are all lined up. Remember, temperature goes up when progesterone is up after ovulation. I hope this gives you some more understanding and appreciation for your female cycles. Through the generations, this system has allowed women to reproduce successfully, as well as use their creative energy in so many other ways. Thanks for these helpful graphics and photos from these great sources. Please like this video on YouTube, check out my other videos like Wise Womanhood also on Facebook, and check out my website at wisewomanhood.com for more information or how to contact me for a consultation. Have a great day!